Gentlemen, let me ask you something honestly. What if there were a single spot on your body, about the size of a coin, that when gently massaged for just 1 minute a day could support blood flow, improve sensitivity, and help revive performance that may have faded over the years? It sounds hard to believe, maybe even a little uncomfortable to talk about. But stay with me, because in the next few minutes, you'll learn exactly where that spot is, why it matters, and how a simple daily habit could be the most natural support your body has been waiting for. I'm Dr. Lila Romano, a board-certified urologist, and for over a decade I've dedicated my practice to helping men reclaim their vitality and confidence. Today, I'm going to show you something most doctors never discuss in their offices, yet it's backed by peer-reviewed research and has helped thousands of men restore what they thought was lost. And before we continue, leave a comment telling me where you're watching from. It's incredible to see men from all over the world supporting one another here. Now, let's talk about the truth behind this hidden spot. Most men believe that after 50, changes in performance are unavoidable. They assume circulation slows, hormones decline, and intimacy naturally becomes harder. So they either ignore the issue entirely or rely on quick fixes that only work temporarily. You know what I'm talking about. Maybe you've tried the pills. Maybe you felt that temporary boost followed by the same disappointment when the effects wear off. Maybe you've started avoiding intimacy altogether because the anxiety about whether you'll perform has become overwhelming. I see this in my clinic every single week. Men who feel embarrassed, frustrated, like their bodies have betrayed them. Men who think they're alone in this struggle. But here's what I need you to understand right now. Age itself isn't the real issue. The real problem is tension and reduced circulation in the pelvic area. Years of sitting, stress, shallow breathing, and inactivity cause the muscles of the pelvic floor, the muscles directly involved in blood flow, control, and sensation, to become tight and unresponsive. At the same time, imagine an old rubber band. It's stiff, stretched out, and has lost its snap. That's what happens inside the body. When these tissues stay tense, blood vessels don't expand easily. Nerves don't communicate clearly, and responses that once felt natural begin to feel unreliable. When that happens, three things occur. First, your blood vessels can't expand properly to allow maximum blood flow where you need it most. Second, nerve signals from your brain to your penis get disrupted and weakened. And third, the muscles that are supposed to trap blood inside during an erection lose their strength and responsiveness. The result? Weak, unreliable erections that fade too quickly, leaving you frustrated and your confidence shaken. But here's the encouraging news. The body is remarkably adaptable. By gently releasing tension and encouraging circulation in the right area, you can help restore communication between the brain, nerves, and blood vessels. This isn't a new idea. Many traditional systems recognized this spot centuries ago. What's changed is that modern understanding now explains why it can be helpful, and the science behind it is genuinely compelling. Let me give you the research that proves this works. In 2005, the British Journal of General Practice published a landmark study that followed 55 men with erectile dysfunction. These men had a median age of 59, so we're talking about men just like you. After 6 months of pelvic floor exercises targeting this exact area, 40% of these men regained completely normal erectile function. Another 35.5% showed significant improvement. That same year, BJU International, one of the most respected urology journals in the world, published a follow-up stating that this approach should be considered the first-line treatment for men seeking long-term resolution of erectile dysfunction. And it didn't stop there. A 2019 systematic review confirmed that targeted pelvic floor work is effective not just for erectile dysfunction, but also for premature ejaculation and overall sexual satisfaction. These aren't alternative medicine studies. These are peer-reviewed medical journals with rigorous standards. So what's actually happening beneath the surface? Here's the anatomy lesson you need to understand. The area we're talking about is called the perineum. It's located between your scrotum and your anus. And directly beneath that spot lies one of the most important muscles in your entire pelvic floor, the bulbospongiosus muscle. This muscle does three critical things. First, it acts as a natural clamp, trapping blood inside your penis during an erection to maintain firmness. Second, it controls the force of your ejaculation. And third, it supports bladder control, which is why some men notice improvements in urinary function when they work on this area. Running through this same region are branches of the pudendal nerve, which carries arousal signals from your brain down to your genitals and back. Again, when you massage this spot with the right pressure and technique, you're directly stimulating blood flow to these structures, releasing chronic tension that's been building for years and reawakening nerve pathways that may have become sluggish or unresponsive. I've seen this work in my own practice. I had a 58-year-old patient who came to me exhausted and defeated. He tried everything: pills, pumps, even injections. Nothing gave him consistent results. I taught him this exact technique, and after just 3 weeks of daily practice, his morning erections returned for the first time in 5 years. He told me he felt like a switch had been flipped back on. Another gentleman in his early 60s came back for a follow-up and shared something unexpected. He said, "Dr. Romano, not only has my response improved, but my lower back feels looser, my hip discomfort has eased, and I'm not getting up 3 times a night to use the bathroom anymore." He simply felt more like himself again. And that's what this is really about: quality of life, confidence, dignity. Now, I know some men feel hesitant about this. Many have never paid attention to this part of their body before. It might feel awkward or uncomfortable to even think about. But let me be very clear with you. This isn't strange, and it isn't something to feel embarrassed about. This is about restoring function, reclaiming comfort, and taking control of your health in a meaningful, proactive way. You're not doing anything bizarre. You're simply giving your body the attention and care it needs to work the way it was designed to. So let's get practical. This technique is simple, and it should never feel forced. The area you're looking for is located between the scrotum and the anus, right in the center. It may feel slightly softer than the surrounding tissue. If there's mild tenderness when you first press on it, that's actually normal and often a sign you're in the right place. That tenderness means there's tension stored there that needs to be released. Beneath this coin-sized spot lies incredible machinery. You're accessing the bulbospongiosus muscle, which is the muscle that locks blood inside your penis during an erection. Think of it as a natural valve or clamp. When it's weak or chronically tight, blood escapes too quickly and erections soften before you want them to. You're also accessing branches of the pudendal nerve, which carry those critical arousal signals to and from your brain. When these nerves are sluggish, arousal feels delayed or muted. And finally, you're stimulating a rich network of blood vessels, the very arteries that feed the erectile tissue. When circulation improves in this area, it improves everywhere downstream. By massaging this one spot, you're addressing all 3 systems at once: blood flow, nerve signaling, muscle tone. It's elegant in its simplicity. But before I show you the exact technique, let me address the mistakes I see men make, because understanding what not to do is just as important as knowing what to do. The first mistake is chronic pelvic tension. Stress, long periods of sitting, even unconsciously clenching throughout the day, cause these muscles to stay locked up. When that happens, circulation slows and sensitivity fades. Gentle massage helps relax that tension, like loosening a knot that's been restricting movement for years. The second mistake is over-reliance on pills. While medication may create temporary effects, it doesn't address flexibility, circulation, or nerve signaling. That's why results often feel inconsistent. One day it works, the next day it doesn't. You're treating the symptom, not the cause. Gentle, consistent techniques work with the body instead of forcing it. And the biggest mistake of all, believing that age means decline, is inevitable. I can't tell you how many men well into their 60s, 70s, even 80s are surprised to discover how responsive their bodies still are once circulation and relaxation are properly supported. The body doesn't forget, it simply responds to attention. Now, to understand why this technique is so powerful, you need to understand what's actually happening during an erection. It's not random, it's a precise, coordinated sequence. Arousal begins either in your brain from a thought or from physical touch. Your brain sends signals down your spinal cord, through the pudendal nerve, to the smooth muscle inside your penis. Those signals tell that smooth muscle to relax. When it relaxes, blood rushes into the spongy erectile chambers called the corpora cavernosa. As they fill with blood, the veins that normally drain blood away are compressed, trapping the blood inside. Then the bulbospongiosus muscle contracts to maintain that pressure and keep you firm. It's a beautiful system when it works, but here's where age and lifestyle create problems. After 50, several things start to break down. First, blood vessels lose flexibility, especially if you have high blood pressure, diabetes, or high cholesterol. Stiff arteries can't expand fully, which limits blood flow. Second, nerve conduction slows. The pudendal nerve doesn't transmit signals as quickly or as strongly, meaning arousal signals become weaker and slower. Third, the pelvic floor muscles, including that critical bulbospongiosus muscle, weaken with age, especially if you're sedentary. Weak muscles can't trap blood effectively, so it leaks back out and erections soften. And here's the paradox. While these muscles weaken, they also become chronically tight from stress and sitting. This creates a locked-up feeling that restricts movement and blood flow even further. It's like having a muscle that's both weak and cramped at the same time. The 1-minute massage targets all four of these problems. It restores vascular flexibility by encouraging nitric oxide release in the blood vessel walls. Nitric oxide is the molecule that tells blood vessels to relax and open. It's the same pathway Viagra works on, but you're stimulating it naturally. The massage reawakens nerve pathways through repeated stimulation. You're essentially exercising those neural connections. Neurons that fire together, wire together. That's neuroplasticity at work. It strengthens the pelvic floor because the gentle pressure acts like a targeted workout for the bulbospongiosus muscle. Over weeks, it regains tone and responsiveness. And finally, it releases chronic tension, like foam rolling a tight muscle. You're breaking up adhesions and restoring proper tissue movement. All right, now let me walk you through the exact protocol. Timing matters. The best times to do this are first thing in the morning, right after you wake up, or in the evening before bed. Morning practice sets a positive circulatory tone for the entire day and supports those natural morning erections. Evening practice promotes relaxation and supports overnight testosterone production, which happens primarily during deep sleep. Pick one time and stick with it for consistency. What matters most isn't the specific time of day. It's doing it every single day without exception. First, create the right environment. Wash your hands thoroughly. Find a comfortable, private space where you won't be interrupted for a few minutes. Have your oil ready. I recommend castor oil as my top choice because it penetrates deeply into tissues, reduces inflammation, and improves lymphatic drainage. Coconut oil is a great alternative if you prefer something gentler and soothing with natural antimicrobial properties. Black seed oil has a long history in traditional medicine for supporting circulation. Choose one and stick with it. Warm 5 to 10 drops between your palms by rubbing them together. Never apply cold oil to sensitive tissue. It's uncomfortable and counterproductive. Now, let's talk about positioning. You have 3 comfortable options. The first is lying down on your back with your knees bent and your feet flat. This is the most relaxed position and ideal for beginners. The second is sitting on the edge of a chair, leaning slightly forward. This gives good access and works well if lying down isn't convenient. The third is standing with one leg elevated on a stool or the edge of the tub. This is less common, but some men prefer it. Choose whatever feels most natural and gives you easy access without strain or awkward reaching. Apply the warmed oil to your index and middle fingers. Locate the perineum, the center point between your scrotum and anus. Now, apply gentle pressure using those two fingers. Think of the firmness you'd use to check if a tomato is ripe. Firm enough to feel contact and reach the deeper tissue, but never painful. You're not pressing straight down. Angle slightly upward toward your belly button. This helps you reach the deeper bulbospongiosus muscle beneath the surface. If you feel a small, firm area or a slight marble-like texture, you've found it. For the next 60 seconds, use one of these 3 massage patterns. The first is circular motions. Make small, slow circles about the size of a dime. Circle for 20 seconds in one direction, then reverse and circle for 20 seconds in the other direction. Finish with 20 seconds in whichever direction feels best. The second pattern is press and release. Press inward with moderate, steady pressure for 2 seconds, then release for 1 second. Repeat this rhythm for the full 60 seconds. You should feel a gentle pulsing sensation as blood responds. The third pattern is an upward sweep. Press in and slowly sweep upward toward the base of the penis, then release and return to the starting point. Repeat for 60 seconds. Whichever pattern you choose, maintain steady, deep breathing throughout. This is critical. Inhale through your nose for a count of 4, then exhale slowly through your mouth for a count of 6. This activates your parasympathetic nervous system, the rest and digest mode that's essential for sexual function. Shallow, rapid breathing keeps you in fight or flight mode, which actively suppresses erectile function. During the massage, you might notice several sensations. A warm, tingling feeling is increased blood flow reaching the area. A gentle pulsing is your pudendal artery responding to the stimulation. Mild tenderness that gradually softens is tension releasing from the muscle. Occasional twitches in the pelvic floor mean the muscles are activating and waking up. You might even notice mild arousal or a stirring sensation. This is actually a very good sign. It means the technique is working and your body is responding. None of these should be painful. If you feel sharp pain at any point, reduce pressure immediately. After 60 seconds, gradually reduce the pressure. Don't just stop abruptly. Place your palm flat over the area and hold it there for about 10 seconds. This seals in the work you've just done and gives your nervous system a moment to integrate the stimulus. Wipe away any excess oil with a warm, damp cloth, then wash your hands thoroughly. Now, let me be very clear about the mistakes you need to avoid, because doing this incorrectly can prevent you from getting results or even cause discomfort. First, too much pressure. This is not a deep tissue massage. You should never feel sharp, stabbing pain. If you do, you're pressing far too hard. Reduce pressure immediately. The goal is firm but comfortable contact. Second, inconsistent practice. Doing this for 10 minutes once a week will not work. One focused minute every single day beats sporadic longer sessions every time. Consistency is everything. Third, expecting overnight miracles. This is retraining your body, not forcing it. You're rebuilding neural pathways, improving circulation, and releasing years of accumulated tension. That takes time. Be patient with the process. Fourth, skipping the breathing. I cannot stress this enough. Shallow breathing keeps you in fight or flight mode, which actively suppresses erectile function. Deep, slow breathing is essential to activate the relaxation response. And fifth, using the wrong angle. Pressing straight down won't reach the bulbospongiosus muscle. You need that slight upward angle toward your belly button to access the deeper structures. Now, who should not do this technique? If you have any of these conditions, consult your urologist before starting. Active prostate infection or prostatitis, recent pelvic surgery, meaning within the last 6 months, hemorrhoids or anal fissures, chronic pelvic pain syndrome, a history of pelvic trauma, or if you're on blood thinners, because there's an increased risk of bruising with manual pressure. Let's talk about what to expect and when. In the first 2 weeks, you're teaching your body to recognize this new stimulus and building the habit. The area may feel tender or sensitive at first. This is completely normal. You'll notice increased awareness of your pelvic floor throughout the day. You might find yourself consciously relaxing those muscles when you notice tension. Many men report deeper, more restful sleep during this phase. You might have more vivid dreams or dreams with sexual content, which is a sign of increased nighttime circulation. The tender spots should gradually become less sore as the chronic tension begins to release. Don't expect dramatic erection changes yet. You're laying the groundwork. Trust the process. By weeks 3 and 4, this is when most men start noticing the first real, meaningful changes. Morning erections may return or become noticeably firmer and more reliable. You might feel increased sensitivity during urination, which is actually a sign of better nerve function in the pelvic region. Arousal comes more easily and feels more natural, less forced or mechanical. The chronic tension in your pelvic area feels looser and more relaxed. And some men report better bladder control and fewer nighttime bathroom trips because you're strengthening the same muscles involved in urinary function. These early wins build momentum and confidence itself is a powerful performance enhancer. By weeks 5 through 8, you should see measurable, undeniable improvements. Erections are noticeably firmer and last significantly longer. Recovery time between erections shortens, meaning you can perform again more quickly. Sensitivity during intimacy improves dramatically. Everything feels more alive, more responsive, more present. Your confidence returns in a way that feels natural and earned, not artificial. You're not anxious about whether you'll perform. You know you will. And here's something beautiful that often happens. Your partner may notice the difference before you even mention what you've been doing. That external validation can be incredibly powerful. After 3 months of consistent practice, the benefits plateau at a new, higher baseline. At this point, you can reduce frequency to 4 or 5 times per week for maintenance if you choose. Many men report that these improvements continue and feel stable even if they occasionally skip a day. The neural pathways have been retrained. The muscle tone has been restored. The circulation patterns have been reestablished. Now, let me give you a few simple daily additions that will multiply these results even further. First, hydration. Your blood is 90% water. If you're chronically dehydrated, your blood volume drops and circulation to every part of your body, including your penis, suffers. Drink 8 to 10 glasses of water daily, starting with a large glass first thing in the morning to rehydrate after. Sleep. And reduce alcohol consumption. Alcohol is a diuretic that dehydrates you and directly suppresses testosterone production. Second, eat foods that support nitric oxide production naturally. Beets and beet juice are incredibly high in nitrates that your body converts into nitric oxide. Dark leafy greens like spinach, kale, and arugula work the same way. Pomegranate juice has been shown in studies to improve erectile function by 25%. Dark chocolate with at least 70% cocoa, about 30 to 40 grams, daily supports vascular health and nitric oxide. And watermelon is rich in L-citrulline, which your body converts into L-arginine, a direct precursor to nitric oxide. Third, daily movement. Sitting all day compresses and weakens the pelvic floor. Combat this with a 20 to 30-minute daily walk. Do hip-opening stretches like child's pose or pigeon pose to release tension. And incorporate squats into your routine because they naturally engage and strengthen the pelvic floor. And finally, prioritize sleep quality. Testosterone is primarily produced during deep sleep. 90% of your daily testosterone production happens overnight while you're sleeping. Aim for 7 to 9 hours nightly. Keep your bedroom cool, ideally between 65 and 68 degrees Fahrenheit. And avoid screens for at least 1 hour before bed because blue light suppresses melatonin production and disrupts the testosterone production cycle. So here's what I want you to do. Commit to 30 days. 1 minute. Every single day. No exceptions. Mark it on your calendar. Set a phone reminder if you need to. Make this Non-negotiable, like brushing your teeth. Track your progress along the way. Note any changes. In morning firmness, sensitivity during the day, arousal patterns, or overall confidence. After 30 days, come back to this video and leave a comment sharing your results. I read every single comment. And if this message gave you hope, tap the like button right now so more men can find this information. This is Dr. Lila Romano, and I'll see you in the next video.